What if I told you that the future of healthcare in the US could be drastically different depending on who wins the next presidential election? Today, we're diving into one of the biggest issues shaping the US presidential race: healthcare reform. Whether it's the fate of the Affordable Care Act or the next steps in healthcare innovation, each candidate has a different vision for the future. Let's start by understanding what's at the center of this debate: the Affordable Care Act, or the ACA, also known as Obamacare. The ACA was created to make healthcare more accessible, especially for those without insurance. It introduced things like coverage for pre-existing conditions and expanded Medicaid to cover more low-income individuals. For some, this law was a game changer, but others, not so much. Some critics argue that while the ACA expanded access to healthcare, it also increased premiums and put a lot of pressure on small businesses. Others believe it didn't go far enough, leaving too many gaps in the system. So, what happens next? Well, it depends on who you ask. Let's look at Donald Trump's stance. Trump has been a vocal critic of the Affordable Care Act, calling it a disaster. He's made it clear. His goal is to repeal the ACA and replace it with a system that promotes private health insurance, giving states more control over how healthcare is managed. Trump's healthcare plan emphasizes choice, the freedom for Americans to choose their insurance and healthcare providers without government mandates. He believes that a market-driven approach will lower costs and improve care by encouraging competition. Trump's vision also focuses on expanding health savings accounts, HSAs, where individuals can set aside tax-free money for medical expenses. The idea is that giving people more control over their healthcare dollars will make them more conscious consumers, driving prices down. But here's the thing: repealing the ACA could leave millions without health coverage, especially those who gained insurance through Medicaid expansion. Trump argues that his plan will create cheaper alternatives and that the ACA is unsustainable. But opponents worry about how repealing it would impact vulnerable populations, particularly those with pre-existing conditions. Now, let's shift gears and look at Kamala Harris's vision for healthcare reform. Harris has taken a different approach. She's a supporter of the Affordable Care Act, but she also believes it's just the first step. Harris wants to go further. Her proposal? A move toward Medicare for all. In this plan, the government would provide health care for every American, effectively eliminating private health insurance. Supporters argue that this would simplify the system, lower administrative costs, and ensure universal coverage. But there's a catch. How do you pay for it? Harris suggests funding it through taxes on the wealthiest Americans, but critics argue that it could be a massive hit to the federal budget and result in higher taxes for the middle class. It's a trade-off: universal coverage versus higher costs, with the idea that in the long run, everyone would benefit from more consistent access to care. Harris also supports lowering prescription drug prices and expanding healthcare access in underserved communities, focusing on reducing the racial and economic disparities in the healthcare system. So, what's the key difference between Trump's and Harris's healthcare visions? For Trump, it's about private control and state flexibility. Less government interference, more competition, and more consumer choice. For Harris, it's about government intervention, expanding coverage through a Medicare for all system to ensure that healthcare is treated as a right, not a privilege. But what does this mean for the average American? On Trump's side, you might see a shift toward more personal responsibility for healthcare expenses and less government involvement. On Harris's side, you'd likely have guaranteed coverage but potentially higher taxes or longer wait times for services due to an overhauled system. So, which future seems more likely to lead to lower costs and better healthcare for all? Will it be a system of more choice and competition, or one where the government guarantees universal coverage? The answer depends on what Americans value most: freedom or equity when it comes to healthcare. And the future of U.S. healthcare? Well, it's still being written. Thanks for watching Mind Circuit. Don't forget to like and subscribe. Let me know in the comments. How do you think healthcare reform should happen? Should we expand on the ACA, move to Medicare for all, or go in a different direction entirely? Stay curious, and I'll see you next time.